Workplaces change. Repeating and revising hazard assessments helps prevent unsafe and unhealthy working conditions. Incorporating the tips recommended in this video tutorial series can be a bit awkward and clunky at first, but does get easier to do with time and practice. The OHS code requires employers to repeat a hazard assessment at reasonably practical intervals, when a new work process is introduced, when there are changes to work processes, operations, or the worksite itself, or before the construction of other significant additions or alterations to a worksite. Inspections are a key part of a functional internal responsibility system and can give you key information about your hazard assessments. For instance, by checking if existing controls work or that new hazards haven't been introduced to your worksite since your last hazard assessment was done. Including MSD hazard checks in your worksite inspections is easy, but to be effective, they should take into account some key considerations. People doing formal inspections should have some basic ergonomic awareness and useful tools, such as reference standards to OHS legislation, guidelines, or checklists. As well as looking at the work area where workers perform their tasks and the equipment in use, MSD hazard checks should also look at how workers are working and evaluate what is being observed against what should be done. Are workers using the controls that are in place? Is equipment in good repair? Requirement to engage workers during the inspection. For instance, have workers demonstrate a work activity they find challenging or difficult, and then discuss strategies that may improve the design and performance of that activity. It is also a great way to clarify understanding or get suggestions and feedback. Except when eliminating a hazard, MSD prevention may require workers to learn new habits, such as implementing a new policy. Be reasonable about timelines to see change. Again, inspections themselves can be a great way to remind workers about ergonomic principles and healthy practices. Remember to look for factors that affect MSD risk when doing a worksite inspection that takes MSD prevention into account. These include the environment, equipment, materials, and people. For example, environmental conditions such as safety devices in use, vibration exposure, extreme temperatures, overloading, crowding, or failing to balance, handling materials in unsafe ways, physical demands of work tasks, such as contact forces, repetitive motions, static positions, and work speeds, using the hands or body instead of tools or other assisted devices, or failing to use or not properly using personal protective equipment. Successful MSD prevention relies on inspections being done properly, including having a system for following up when changes are needed and sharing findings and corrective actions with workers. Also remember that there are different types of inspections and that you'll get the most complete picture of how well your controls are working by looking at data from different sources. Formal inspections occur regularly, usually on a set schedule, and are systematic. Typically, they use a checklist to make sure that all controls are in place and nothing is missed. Informal inspections can occur infrequently or spontaneously and may not involve documentation, unless, for instance, changes to work processes or other controls are needed. Examples of informal inspections include walkarounds or job observations, where a supervisor checks how a worker is working and gives direct feedback, including, if necessary, asking for immediate corrections. And hazard hunts, where workers survey a workplace looking for hazards. Add information about MSD hazards and that their controls are in place to existing checklists you may use. You can use a second checklist that focuses on ergonomics along with your main inspection checklist. Either way, checks should be specific for your worksite. In making your observations, you can use a rating system that's simple as yes or no questions about the tasks. For instance, are workers lifting from floor to waist level as per our safe lift manual? Or you can use a more detailed rating system that refers to workers' hazard assessments and physical demands analyses. You may want to pause the tutorial to study the sample checklist listed on the bottom left link on the screen. You can also think about what to include in a checklist that fits your workplace. Checklists also need to work for your inspection team. The team needs to understand how to make and record required observations correctly and feel comfortable using the tool. The checklist should also have space to capture observations that aren't on the preset list. and to make notes about corrective actions. Training your inspection team on how to use your inspection tools is critical to a healthy and safe workplace. Training can include how to use any inspection tools, strategies for conducting the inspection, such as working left to right in a room and looking bottom up in each area, or a timeline format, what you should do before, during, and after the inspection. Evaluated over time, inspection records can also help you identify trends in health and safety outcomes. Are people using ergonomic principles more frequently, for example, over a period of time? When evaluating the inspections, you're comparing the risk results with previous results and a set of standards. You're also looking for trends that can be measured in various timelines, such as daily, weekly, monthly, per season, annually, by industry phase. This trending report should summarize conclusions, provide action items, and be shared with key stakeholders. This wraps up the tutorial series about MSDs and how to prevent them. The series covered why MSD prevention is important, how work contributes to MSDs, assessing MSD hazards and controlling them, ergonomics, and how inspections can help prevent MSDs. You are encouraged to review the tutorials and other resources as often as possible. They can help you make MSD prevention one of the health and safety priorities at your workplace. The tutorial series is produced by the OHS Prevention Initiative, a partnership between the Alberta government, industry, labor, and health and safety organizations. The following organizations contributed to this tutorial.